Hello, I'm Nadia Bilchik, and I'm delighted to be with you once again. I always promise you informative people, informative topics. Last week, I introduced you to the doctors Bilchik, Anton Bilchik, Brian Bilchik, and Tanya Bilchik. But this week, we in fact have a surprise guest. So we do have Dr. Anton Bilchik, but Anton is going to introduce our surprise physician who's joined us because the other Dr. Bilchiks unfortunately couldn't, but we have a great replacement. Anton, won't you share and introduce our surprise guest?
Yeah, I'm happy to. So I'm at the John Wayne Cancer Institute and Providence Hospital in Santa Monica, Los Angeles. And one of my closest friends is Jen Linehan, who's a urologic surgeon. And yesterday, Nadia, you interviewed Deepak Chopra. And not only is Jen an excellent surgeon, but she's been very involved in mindfulness and in general physician well-being. And literally, as we speak, Jen is in a crazy clinic. I mean, she's been given exactly like 2 minutes notice to do this. And she just very graciously agreed to come on live. So, with that in mind, it'd be, really great to hear from Jen as to what led her to, help lead the program of Burnout mindfulness in our organization.
Jen, what advice and guidance are you giving your patients? So it's COVID-19. Not only are we dealing with the divisive political world, but the burnout of COVID-19. So any advice or guidance that you can give us?
I really tell my patients that they need to focus every day on taking time for themselves outside, getting outside the house, away from their screens. Even if it's just 30 minutes of slow walking, it can be very relaxing for them. It allows your mind to disengage from the world around you and really focus on just their breathing and walking and not listen to music. Don't even take their phone with them. And I think COVID has us all constantly focusing on our devices and on our computers, and we don't get a chance to look into ourselves, and doctors as well. I mean, the electronic medical record, while it has been amazing for communicating with our patients, it also leaves physicians very little time to escape from doing notes and checking charts, and so we all have to focus.
It's so interesting. We were having that conversation, Anton. When we grew up, your doctor actually looked at you, not at his computer.
Yeah, and I mean, I couldn't agree with Jen more. I mean, at the end of the day, you can spend many hours with your patients, but then you're in front of a computer. So let me ask, Dr. Linehan, what she does, because she does some very, very complex cancer operations, robotic kidney operations. She does some of the most complex cancer operations. So Jen, after you've been in the operating room for 8-9 hours, it's the end of the day, it's late, you're tired, fatigued. What do you do to practice mindfulness? Do you
meditate?
What do you
meditate? No, so again, my thing is walking. I have to get out of the house. I have to decompress from the day, because when you go back in the house, sometimes I'm still not able to just decompress from everything. So I literally will just walk around outside my house or even outside the hospital sometimes, just to relax and let my brain escape from the day's events and just take a breath and calm down.
Anton, what do you do?
What do you do?
Yeah, so it's I never actually until recently knew what burnout was until I started waking up with headaches and a whole bunch of other symptoms, and now it's become so much more clear to me, and I think that something that's really important is to be with people that you like, to share your thoughts, share your emotions, and find time. Just to talk about things other than the things that bring us down, and you have to laugh, and you have to just be with people that you really enjoy being with, and quite frankly who you trust, because we are going through a very, very difficult time, And the other thing I actually did today was just leave my office and take a walk. Now, the temperature in Los Angeles is about 95 degrees. So I don't know if it was very therapeutic to take a walk down the block. I felt like just getting back to the office. But anyway.
And everything both of you are saying, I mean, Dr. Deepak Chopra backs up with neuroscience around being present. He spoke last night about sometimes just listening to your breath. And by the way, the book on total meditation is really worth it for everyone, whether you've meditated or not. I cannot have two highly, highly accomplished physicians without asking you about flu season is coming up. And Jane, let's start with you. It's controversial. I mean, what do you tell patients? Do we do the flu shot? Don't we do the flu shot? With COVID, is it a risk going in? I mean, help us decide.
I mean, I have seen myself this year make a change in my recommendations for the flu test. I mean, I have patients that come in previous years and, they were healthy, younger patients and, okay, I didn't push them to get the flu test, but I think this year it's incredibly important with COVID happening at the same time that our body be able to defend itself at least against the flu. And for me, it is not controversial. I recommend it to all my patients, my mother, my aunt, my mother-in-law, to make sure that they get the flu shot as soon as possible.
And Anton, I mean, as a cancer surgeon, you deal with so many high-risk patients. And I know you work a lot at understanding other ways of staying healthy.
Yeah, so I think that I find myself a good part of the time when I'm with patients talking about exercise and nutrition. Somehow the conversation gets, down to discussing exercise and nutrition, because I think we're learning so much more about de-stressing through exercise. Exercise is an anti-inflammatory. Exercise, can prevent you from getting heart disease, prevent you from getting cancer. And if you do have cancer, you actually respond better to treatment with exercise. Exercise certainly doesn't have to be running marathons. Just taking walks for 30 minutes a day, and healthier eating habits.
Isn't it interesting, though, that Dr. Chopra spoke about these things 20, 30 years ago, and suddenly mainstream medicine, right, is understanding how important sleep is and nutrition and mindfulness. And I love, Anton, what you said about being with wonderful people and having your friend, Dr. Lanahan, come onto a call at the very last minute, having a sense of humor. So many things that anybody who's watching this goes, I know I should be doing, but how do I do it? As a urological surgeon, Jane, I mean, you dealing with urological issues, are they exacerbated by this level of stress that people are experiencing?
I think so. I think the last couple of weeks, I have seen more patients who have weird bladder inflammation, irritation, urinary urgency and frequency. And I have been trying to figure out, is that because people are changing their habits? Are they drinking more? Are they drinking more coffee? Are they drinking more alcohol? Things that can inflame the bladder. Or is this purely out of stress? And I almost every patient that comes in the office has some level of stress from COVID, whether that's financial or being stuck at home or the kids or something. And I'm seeing more of these bladder inflammatory syndromes. So I think that there is something urological that is coming from COVID. And I do think it has to do with stress. And also, just to add to your point, sleep is incredibly important. And I think we all do not pay enough attention to that. And getting a good 7 to 8 hours of actual sleep is really healthy for your body. So one of the reasons I actually see patients is because they're getting up at night to urinate, and that's breaking up their sleep, which I also think is partially because of COVID, because people have gotten off their typical normal sleep cycles because the days just kind of continue on. There's nowhere to go.
I wish I had longer with both of you. I know that you're in the middle of a clinic. Anton's about to do a surgery. So I'm going to quickly ask you, Anton, with you, if you can say you're on a podium, what advice, guidance do you have generally for us to be healthier? And what's interesting is both of you are going through what a lot of your patients are going through in dealing with COVID.
Well, first, let me just say that, both Jen and I were dealing with complicated cancer patients during COVID. At times, we became their families. They really didn't have anyone that was allowed to visit them. And so we became their support, and they became our support. And I think that's something that I learned a lot about. I think compassion and caring are the two most important things that I've really learned through this ordeal that I really hope to improve on even once this pandemic ends.
Dr. Lenahan.
Yeah, no, that is an excellent point, Anton. I think while the patients were in the hospital, they weren't allowed to see their families, and we really became their sort of support network that they looked to because they couldn't have anyone in the room with them. So compassion is a great one. And I think COVID has also taught me patience. There are some things that you just cannot push through and cannot rush, and you just have to take your time with yourself and with your patients.
I cannot thank you both enough for sharing your time. Next week, we can talk about things to do with urology, like does cranberry juice really work?
Great. Yes, we can definitely discuss that next week.
Okay, thank you both so much. Is there any question that you, Jen, would like to ask Anton? And Anton, any other question you would like to ask Jen before we wrap up this fascinating conversation?
Well, I just started by asking Jen, how was she able to find 5 minutes in the midst of her crazy clinic to do this interview with 3 minutes notice and look so good at the same time?
I have to say,
thank you, Anton.
TV savvy. Anything specific you want to ask Anton, or anything else you'd like to share?
Anton, are you finding time to get away and take a break from your computer? Anton is an incredibly busy surgeon and has a ton of patients calling him all the time on his cell phone. Are you actually making time for you?
Not enough. No, absolutely not. But I did. I'm trying to. I've made a little slide of this talk that was given to us on Saturday about the 9 ways to enhance resilience, and I'm trying to learn from that.
Good. And I want you both to know that I will be sending you each a copy of Deepak Chopra's latest book, Total Meditation, Practices in Living an Awakened Life. So it sounds like you're doing part of it, but we can always
do better.
We can always do better.
Isn't that the truth? There's lots to learn. But thank you both so much for joining me. Dr. Anton Bilchik, who is a cancer surgeon in Los Angeles, and Dr. Jennifer Lenahan, who is a urologic oncologist. Thank you both, and I hope you will join me again with more insights here on Nadia Speaks. Thank you both so much.